Encounter is brought to you by the Broome County Council of Churches.
Good morning and welcome to Encounter, sponsored by Broome County Council of Churches. I'm Dave Alexander, one of your hosts. Today we're very fortunate to have two representatives of the Broome County Health Department here. We're going to be talking about smoke-free and lead-free. I have Sarah Walker, who is a health educator and is responsible for the lead-free program. Sharon Fisher, who is also a health educator, is a coordinator for the tobacco-free program for, I guess, not only Broome County, but Tioga County?
We have a coordinator there too, but I work in both, that's right.
So we're going to have an interesting conversation, as we were talking just a few minutes before, about the things that are in the paper. So there's a lot of things going on about the smoke-free thing. So I guess we'll start with Sharon, and I guess what is the purpose for today for the program?
Okay, what I want to do is talk about the programs in our local community, to talk to the viewers to see what our local programs are doing to protect residents from secondhand smoke, and also to help smokers quit and protect youth from starting to smoke.
And why is reducing New York's tobacco use so important?
Well, sometimes people don't realize that smoking is the leading cause of preventable death, or tobacco use is the leading cause of preventable death in our country and the world. It's a huge public health problem, and smoking kills more people than alcohol, HIV, AIDS, motor vehicle accidents, homicides, suicides, cocaine and heroin use combined. So it takes a huge toll on our population.
Yeah. And how do we reduce the tobacco use rate?
Well, one of the key things is to take a look at helping to prevent youth from starting to smoke. That's really key, because we know that almost 90% of smokers started before they were 18, or by the time they were 18, and that almost 100% started by the age of 26. So smoking is something that happens to a person starts smoking when they're young, and because it's such an addictive substance, many think they'll be able to quit when they're older, and it's very difficult to do so.
How do you protect the youth from starting to smoke?
Well, one of the great things in New York State is we do have a very effective and comprehensive tobacco control program. We have a lot of very important policies that are in effect in New York State, and some of those are things like there is a law that requires that tobacco be kept behind the counter, which makes it very difficult for a young person to kind of pocket some tobacco, because once they start, they're oftentimes very quickly addicted. Another thing we have in New York State is called our ATUPA law, and what that does is help to identify tobacco retailers that are selling illegally to underage youth, and that's very effective to keeping the tobacco retailers from not selling to underage youth. We also have very high taxes on tobacco in New York State, and we know from research that that helps to deter youth from starting to smoke, and also provides an incentive for established smokers to quit. And I'm sure everybody has seen some of the media that's very effective, the graphic images about consequences of smoking. And even though we do get complaints about those, we know that those messages and those sometimes gruesome images are very effective, because we track the number of calls to the quit line, and they definitely spike when those very powerful media messages are playing. So those are some of the things that we've been really successful. But in addition, what we're working on locally, in addition to those, is we are working to create tobacco-free or smoke-free outdoor areas to kind of denormalize smoking in our environment, because we know that the less that youth see smoking in their normal everyday environment, the less likely they are to think that they want to smoke, or that it's just a normal thing to do. So we work hard on that. And actually, Endwell United Methodist Church and St. Mary's in Kirkwood have contacted me to establish their church property as smoke-free grounds. And we do provide signage, and I have some examples of some of the signage here. This is a very attractive, I think, signage that we do provide. And we can also personalize them with logos, etc. So having these tobacco-free grounds or even tobacco-free entryways sends the message that we are interested in protecting people from secondhand smoke, but also that smoking is not a desirable behavior, and it's something, therefore, that helps protect the youth.
And you and I had been in conversation, at least as far as Enville Methodist.
Right.
And it's amazing because we do have a Monday night dinner, and a majority of those people smoke, and so they'd be outside the door smoking, and they'd come in, just reek of the smoke. But once we put the signs up, and of course it was a little educational process, probably for about a month, explaining to them what the sign means. I mean, some people would stand there and still smoke right by the sign, but we finally got the message across that, you cannot smoke on the church property, whether it be in the parking lot or whatever. So you need to either go across the street, and I tell you, it's made a big difference. We still have a few people that will go across the street and smoke, but a lot of the people that I know normally did smoke, don't smoke anywhere near the church. Right. So it has had an impact. And I know a lot of the people that come to church on a normal basis, when they first started seeing the signs, they were so happy. They said, this is a great thing for the church to say, okay, we're not going to allow this. Because for a long time we had the little smokers pots out by the door, so you could put your butts in it and everything, and people, of course, throw the butts all over. Didn't matter. But so we've eliminated all that. And it's just made it a lot better environment all the way around. And the fact too, we have like a nursery school there, so now you don't have to worry, about the smoke being around, because you're affecting like you said, secondhand smoke. And I think you even talked about the third-hand smoke too. So I mean, it's very important that, from our church's standpoint, it's a great program, and we really were happy. I mean, you provided all the signage, you provided the posts. All we had to do was put it up. I mean, you can't ask for a program that's going to give you so much, and it's just the idea of really helping out. So it's a great thing.
And if any other churches are interested, just give me a call. We've also worked with different municipalities that have established tobacco-free playgrounds and athletic and spectator areas. We also worked hard with BCC. Broome Community College adopted a smoke-free campus. And that was several years in the making. But just like you were saying, Dave, we worked with so many students who were trying to quit smoking, and they told us that when they would get to school and they would see other students smoking, it just was a trigger for them, and it was hard for them to quit. So they were excited about the policy, knowing that they probably, this would help in their quit attempt. We've had very good feedback from the majority of the staff and administrators at BCC, and they were definitely key. Debbie Morello and several of the other staff were very key at BCC in getting that, and of course the president was behind it, Dr. Drum. So that has been very successful. So we
and I do know, like, for I think it was like 2 months straight, each entrance had the flashing big sign saying that they are smoke free. I mean, and that, I just thought, what a way to get a message across. I mean, not even for people attending, but as you drive down Front Street and you see those signs, it's nice to know that, hey, here's a campus as big as Broome Community College is, that they've done this. I mean, that's a major undertaking.
It is.
And they get so many people involved.
They did a great job too, that the nurse's office provides nicotine replacement therapy for people wanting to quit, or for people trying to get through, say, a long day of classes without smoking. So it's been very effective, I think, and helpful to a majority of the people on campus.
That's great.
Yeah, and I know, just kind of offshoot, now today's paper, and this is on Wednesday before the show actually airs, there was the article about how New York State parks have designated a lot of areas as not having smoking, and now we have a group of people who are smokers that want to sue the state, saying they didn't have the right to do that. So I mean, it just, you have to wonder what this group is thinking, because really, for people going to the state parks, you're going there for recreation and be able to relax and enjoy, and to know that it's smoke-free is such a better environment. And then you got a group that's saying, okay, now we're going to force the issue. So
I did hear about that. But what the state did was decide that in all state parks, all of the pool areas and all of the playground areas will be smoke-free. And of course that definitely impacts the children, which is great. And several other parts of the different parts of different state parks, such as I believe our state park, Shenango Valley, there is also a policy for no smoking in the beach. Most of them have beaches included, and they have pavilions included. So I think that's very helpful, and most of the patrons will appreciate it.
Now, I know you're working together to protect youth from the positive tobacco marketing messaging.
Oh, yes.
And exactly what does that involve?
Well, I mentioned New York State has been doing a great job in several areas. The one area where we really need to do some more work, and this has been highlighted by the Surgeon General's report that just came out in March, and what the Surgeon General report told us is that advertising and promotion activities by tobacco companies have been shown to cause an onset and continuation of smoking among youth and young adults. So in other words, when you walk into a tobacco retail outlet, a convenience store, whatever, and you go to check out, you often mostly we'll see these huge, what we call power walls, and it's brightly lit, colorful tobacco advertising, packages of tobacco, oftentimes with lights, and it's very attractive to youth. And we knew from research prior to, and also especially now with the Surgeon General report, that's a very effective way. It's very influential in getting youth to start smoking. So what we're trying to do is to educate people, community leaders, about that. And in some places throughout the world, actually, I have a picture, I don't know if they can zoom in on this, but instead of having those big power walls, those big huge displays of tobacco and the advertising and everything, several countries such as England and Ireland and Australia and Iceland now require that tobacco be kept out of view. It has to be in drawers, or it has to be covered somehow, because it's very and what we want to do is actually not allow any of the tobacco to be visible and actually to be covered up. So that's one of the things we're starting to work on. And just last month, the village of Haverstraw in New York State, in Rockland County, enacted the first law in the country that's going to prohibit the visibility of tobacco. So that's huge. Other communities are doing things like prohibiting the sale of tobacco in pharmacies, because it doesn't really make sense to sell tobacco in a pharmacy, you know, and also trying to limit the density, not have a lot of tobacco retailers within a very highly populated area where there's a lot of youth that are visiting the stores, and also to try to keep tobacco retailers at least 1,000 feet away from schools.
Now, what about the media? I mean, movie theaters and...
Yeah, that's another thing that research has shown. When youth see actors, some people that they really look up to, smoking on the screen, that's also an influence. So there has been some work with one of our kind of sister organizations, Reality Check, to try to address that and work with the Motion Picture Association.
Now, how many youth smoke now? Do you have an idea? Or
yeah.
Are there more?
Actually, no. It's been a huge decrease, especially in New York State. We're kind of ahead of the curve because of the different things that I've been talking about. In New York State, in the year 2000, there were 27% of our high school students smoke. So over a quarter